Monday morning and happy Earth Day. It is April 22nd and so thrilled to have you with us. I'm your host, Monica Adams, and the show is The Real Monica Adams Show. We are in our InVita Health and Wellness studios, and we will be joined by Dr. Sara Franco, the mastermind behind InVita Health and Wellness. Today we're going to talk about skincare and all the levels of what they can do as we transition from spring and getting into summer. The warmer weather days are ahead. What can they do to take care of maybe damaged skin or aging skin? She's got a lot of treatments that we haven't had a chance to talk about yet. So she'll be coming up in our second half hour. Dr. Sean Neary from Mid-America Spine and Rehab. He joins us in the first half hour. And today we're talking about Earth Day, and I love his creativity. He said, how about Mother Earth? Let's take care of the moms, and how important it is during and after pregnancy to do those adjustments. So any moms that you know, he's going to talk about the care that they do, and the youngest patient he has ever adjusted. You might be surprised by this one. You know, last week we were talking about tornadoes. We're talking about a freeze advisory this morning. Did you plant already? Did you have to cover up the plants? Well, we're going to talk about that. And one of our first stories in the news you can use has a happy ending after a tornado. We'll get to that in just a second. Let's, however, first start with our aspiring meteorologist, Beckett Moore. Good morning to you.
Good morning, Monica.
I hope you had a fantastic weekend. Yes, Becca, we were just talking about those tornadoes. So let's go back to that before we get into what the weather looks like this week.
9 tornadoes in the St. Louis area. Most of them were into Illinois. We had one, that EF1 tornado down towards Eureka there into Jefferson County. So one tornado there into Jefferson County. And we had a lot of tornadoes, the low end to the east of the Mississippi River. We got one down there in St. Clair. 4 tornadoes there in Madison County, one in Macoupin, one in Jersey County, and then one up in Greene County as well. So we did have that EF1 tornado from the Eureka area over towards High Ridge there into northern Jefferson County. That barn damage we saw at Brookdale Farms was actually tornado damage. We had thought that was wind damage, but after the NWS went out and surveyed that actually turned out to be tornado damage, as you can see that photo right there. But there were 0 fatalities and 0 injuries, which is very good. But 7.8 miles that tornado was on the ground, EF1, so still low end, but stronger than most of the ones we saw in the area. We also did see an EF1 tornado on the ground for 3.1 miles, and that was in Madison County, and then one that was on the ground for around 0.2 miles, some damage to a barn there, and that was there into north of Greenfield in Greene and Macoupin counties. Now, weather schedule for today, 45 degrees and sunny here in the morning, and we're going to be really warming up to around 70, maybe up to 72 degrees as we go into the afternoon with mostly sunny skies. Now, we are going to be having to watch a severe weather threat, and this is for Friday. We do have an area outlined by the Storm Prediction Center where there's the possibility of some severe storm action as we go into Friday, and I do have high confidence that this will be expanded into the immediate St. Louis metro and into most of the St. Louis area as we get closer to the event. But we've been dealing with severe weather. It's storm season, and we've been under the gun a lot of times. It looks like we're going to have another possibility of being under the gun for severe weather as we go into Friday. Again, Friday, and then we may have another chance here on Sunday. But again, Friday, well, more updates through the week, but it's looking like another day to watch for severe storms. And like we talked about, Sunday's going to be another day to watch first. But first, we got to get through the start of the week. 70 degrees, mostly sunny skies today, low of 53. Going into tomorrow, cooling down a little bit with that rain coming through, 66 degrees. We're going to have some rain going into around lunchtime into the afternoon, clearing out around the evening, low of 47. And then into Wednesday, warming up just a bit, mostly sunny skies. And we're going to be really warming up late this week into this weekend, 72 on Thursday with mostly cloudy skies, low of 59. And then moving into Friday, 78 degrees. Thunderstorm chance again. Another day to watch for thunderstorms. Stay tuned for more updates on that. Low 68. And then the Saturday, that's likely going to be our warmest day of the weekend, around 83. Could be getting even higher than that. Wouldn't rule it out, with some showers around, but a little bit of sun as well. And then Sunday, again, we are going to have another threat for severe storms. So you can just see that stretch along the weekend. Lots of precipitation and lots of possibilities for some storms.
Whenever we have rain, Beckett, I never want it to be on the weekend. I want it to be throughout the week. We want to have gorgeous weekends. So we got to get that one changed up a little bit. I do hope you had a fantastic weekend. Anything fun that you did?
No, not really.
No, just chilling, enjoying the weather.
Yeah.
Well, all right. Again, that's aspiring meteorologist Beckett Moore. Thank you so much. And we'll check in again with you a little bit later on this week as we head into the weekend for sure. And we look at those storms. Hope you have a fantastic one. You know, he was talking about the tornado in Brookdale Farms area in Eureka, and I wanted to give you a follow-up. So we told you last week that there were, in fact, people there. They were able to get them out. Nobody was injured in that. But I was sitting there wondering, well, what happened to the wedding, though? Because they were getting ready, doing the rehearsal dinner, and then they were supposed to get married. So, you know, in the news department, I always wanted to have the follow-ups, and the follow-ups sometimes didn't happen. Well, I've got that for you. When the tornado interrupted the rehearsal at Brookdale Farm, the local couple thought that their dream wedding was a complete bust. Think about all the people that come in for the wedding. You have people traveling, friends and family. Thanks to some quick fixes to Brookdale Farm's event space and some adaptations by the venue, Kyle and Taylor O'Driscoll said, "I do," on Saturday evening as planned. They were able to get it underway in the same time frame, which is amazing. By the time their ceremony started, it was hard to tell that there was actually any damage to the event space at all. They exchanged vows overlooking the farm's scenic fields and the hills with the family and friends. Their officiant acknowledged the challenges of the week, saying, quote, "There were a few times we weren't sure that this was actually going to happen, but congratulations to them and kudos to the farm, again, Brookdale Farms, for being able to get that underway. I was wondering if they were going to have to move venues altogether, but yeah, phenomenal. Warm weather last week, by the way, bringing cicadas earlier as soon as the soil reaches 64 degrees underground. Once every 13 years for this particular brood that we're going to see, mainly the Great Southern brood, but there's a rare year this year as two will emerge. Now, the good thing might be that the other one might stay more towards the north because it is more of a northern cicada that will be up near Chicago. The noise, though, is likened to the sound and the volume of a motorcycle. Oh, good for us, right? This is news you can use, folks. This weekend, computers, phones, small appliances, all can be turned in on Saturday. They will be doing a recycling event. It starts at 8 a.m. to 11 a.m. So think about anything that you have that might have a power cord, a battery that you're not using anymore, but that needs to be disposed of properly. Again, they'll be doing this recycling event 8 a.m. to 11 a.m. and the location, 1640 South Kings Highway. 1640 South Kings Highway, and it is absolutely free. They just ask you to bring an ID when you get there. And then lastly, they have a drug take-back day on Saturday as well. It's always very important that these get disposed of properly. Several local police departments will take the drugs starting at 10 a.m. So you might want to check with your local police department and just ask them if you can bring those up. So once again, there are two events that will take place on Saturday. First is the small appliances. The other is the drug take-back day. And in sports news, unfortunately, the Cardinals, they're struggling. They lost 2-0 as they wrapped up their series with the Milwaukee Brewers. They're in action. First pitch will be tonight at 6:45, and that game against the Arizona Diamondbacks. Cross your fingers that they can turn things around. All right, it is 7:09. Let's get into our Medical Monday. We're going to start off with our Ask the Doctor segment with Dr. Sean Neary. He's with Mid-America Spine and Rehab. We love having him on every Monday. I know you do as well. Any questions or comments you have for him, be sure to drop those in the comments section, and I'll be looking at those. I also want to say hi to everybody I had a chance to meet over the weekend. We had two events. One of those was with Ruby Lee on Saturday night. I hope you had a chance to go to that. If you didn't, you missed out on an incredible concert. You also missed out on how kind and how funny she is. We had a chance to bring her out on stage. This is the first, by the way, of several collaborations that we're doing with Ruby. The other is coming up on the 4th of July at Defiance Ridge Vineyard. So if you didn't go to Arnold Saturday night, then you have the opportunity to see her. And she took requests like nonstop from the audience. And I think she really blew so many people away that thought, yeah, I heard her sing on The Voice, but Is she better in person? Yes. The answer is 10 times even better than what you see on stage when you're listening to her, maybe on a radio or you're watching her on TV. There's her sister, by the way. We love to see the whole family. So that was Rickman Auditorium. My friends were out there. There's some of my clients that I personal trained. My mom was there. Michelle was there. My husband was there. And so great to meet so many of you. So again, Ruby, Lee, Casey, thank you so much for having me be a part. There's Mom and Jim. Having me be a part of that wonderful event. The other was yesterday, and it was so endearing to meet all these mothers. We're talking about Mother Earth today, right? Well, yesterday the mothers were pampered. These are mothers whose children have cancer. And there were a lot of tears, a lot of hugs that took place, a lot of me telling all these ladies, you have so much value. We were signing all throughout the afternoon those Know Your Value journals that I donated to these moms. They got pampered. They got their hair done. And look at that beautiful baby. That's the favorite picture I took. She was so beautiful, and she was enamored with my mama. Just, again, the connection between the two was so beautiful. But again, thank you to all that donated their time yesterday to make these women feel beautiful for the day. And I had a chance to do my motivational speaking for about 20 minutes before we had lunch together. As I said, a lot of emotions, laughter, and tears throughout the day. But thank you to Sally Rains and to Michelle Carter to put this together for Rainbows for Kids. And we met Soup yesterday, the guy on the right, Mike Soup. He's from the Ozark Mountain Daredevils. How cool was that? He was there entertaining the kids. And we talked about him coming on the show very soon. So a lot of really awesome things happening over the weekend. A busy one, but so fulfilling. So that was my weekend. I hope you had a good one. And feel free to drop in and let us know what you did. And I'll look at your comments throughout the day. All right, it is 7:12. Let's bring in Dr. Sean Neary. He'll be in the blue chair when we return. InVita Health and Wellness, where you can feel your best both inside and out. InVita isn't your typical med spa. They're a multi-specialty medical spa and wellness center serving St. Louis and its surrounding areas. They have ketamine for mental health and pain, IV therapy, medical weight loss, and aesthetics treatments. As board-certified anesthesia providers, InVita can ensure that their advanced treatments are provided safely with minimal to no pain. So let InVita take care of you. Call 314-394-0950 to book an appointment or online InVitaHealthAndWellness.com.
Hey, The Real Monica Adams listeners. This is Abby Stallschmidt. You may know me as an electric violinist who has performed with various bands in the area, and I'm excited to personally invite you to my premiere at the Sheldon Concert Hall on June 5th at 8 p.m. You'll hear my new symphonic rock music as well as classic rock and pop covers, all backed by a string orchestra, full band, and multiple guest instrumentalists and vocalists throughout the night. It's truly going to be an awesome time. Head on over to MetroTix.com or the Sheldon Concert Hall to get your tickets for the Dream Machine concert on June 5th at 8 p.m. I cannot wait to see you there.
That is going to be incredible. If you haven't purchased your tickets yet, be sure to do so. We'll be there for that as well. It is 7:13, and let's get into our Monday. First of all, good morning to all of you, and happy Earth Day. So Dr. Sean Neary is in with us. Good morning.
Good morning.
Let me bring your microphone up just a bit.
Sure.
Good morning to you. No, you're good there. Just bring that part of it.
There?
Yeah.
All right.
So Earth Day, and I asked for you to be creative with this, and you were thinking about it, and you said, oh, Mother Earth, let's take care of moms.
As you said, every once in a while I get that creative little kick.
Yes.
And it came in that day.
No, I think you do it on a really good basis. So first of all, before we get into moms, I said I was teasing everybody last week. The youngest patient you've ever had.
3 days old.
3 days. Look, my mom's in here, by the way, on the side, and her mouth just dropped. I told you all. Would you have thought that? 3 days old. I don't think I ever would have thought that we could adjust a baby.
Most people don't think about that, and that's what we're here for, is to educate them. The particular case that came in, the baby would not feed on one side of mom. Only wanted to focus on, I think, the right side. It's because the baby could not turn their head. So what we do is we do a small little adjustment on their upper cervicals. Now everybody thinks, oh, you're adjusting a baby? I'm not doing what I do to you, to a baby. So the amount of pressure that you could put on your eye, that's about what we're putting on their spine.
Okay.
So I did a small little adjustment on their spine. I said, Mom, next time the baby goes to feed, try the other side first. And I left her in the room, and right away.
Really?
Yes, fed on the other side.
Oh, did you all just get chills?
Yes,
I did.
It made me so happy.
I'm again, when he told me that, it blew me away. And I'm like, a 3-day-old?
Yes.
Okay, so kudos to the mom for
Yeah.
bringing her baby into you.
Right.
How did she know to do that?
Well, we worked with her throughout her pregnancy,
Oh,
and so
okay.
education throughout
Okay.
the pregnancy. And we say, hey, these are signs to look out for with the baby in the first couple days. Colic, fussiness, not feeding on one side. Bring them in. We'll take a look at them.
Isn't
And
that
she did.
cool?
Yeah, it was awesome.
So for all of you moms, and I have 2 mothers, they just had their babies within the last couple of weeks. I'm going to be passing that along,
Yes.
that you can do this if you're having, because a lot of times moms are thinking it's their fault. What am I doing wrong? I'm a new
Yes.
mom. Why won't I can't get my baby to nurse?
That happens all the time. And on top of that, they're getting so much advice from everyone, as you can imagine.
Yes.
Like, but it's conflicting evidence or
Right.
conflicting, advice. That's what we're here for, is just to educate them
Sure.
on certain things. So as throughout the pregnancy, as we're working with them, we're just talking throughout the time. The adjustment, as you know, doesn't take too long.
Right.
Most of it's talking.
Yep.
Like, do you have
Education.
questions? Education. That's what it's all about.
3-day-old. So
3 days
did
old.
you adjust the baby just that day, or did you continue to see the?
Just that day.
Just that day, and
one.
everything
That's
was
all I
good.
needed. Yep. Next time mom came in, I said, how are they doing? Everything's great.
Oh, I love that.
Yeah.
Again, Dr. Sean Neary, Mid-America Spine and Rehab. And so if the moms are not having an issue with
Mm-hmm.
the baby, then you wouldn't really need to adjust until about what age, would you say?
Well, it depends, because babies go through traumas, and the birthing process is their first major trauma. We love to adjust them within the first week.
Oh.
Because what you have to think about is when the doctor goes in and pulls, they're pulling on their neck. And it's about 30 pounds of pressure. So if you're holding a 30-pound kettlebell, how much weight is that on your arm?
Right?
A doctor is doing that on the baby's head as a newborn. So it's their first trauma, and a lot of times that first cervical vertebrae gets a little shifted, and that's where we see a lot of problems. So we love to do just an assessment, at least within the first week.
Love this. I would have never, all my years, I never would have thought of a baby. So then it just depends on your kids. And I don't think a lot of parents think about taking their young kids to a chiropractor. They'll take them to a doctor, but they may not think, well, is there a certain age I should start bringing my kids to the chiropractor?
Well, you have to think about when a baby or a toddler is starting to walk.
Yeah.
So they stand up and then right on their butt. They stand up, right on their butt. So they're hitting their sacrum. And it's rotating forward, and a lot of times what we'll see is constipation within the baby, within a toddler.
Interesting.
And they're like, well, let's increase fiber, let's do probiotics, let's do all these other things. When what they need is a sacrum adjustment. It's because they keep the micro traumas is what they're called.
Okay, this is one of my favorite shows that you've done so far. These are things I never would have thought. All of you, again, are you thinking the same thing? Like, wow, my mom 5 times already since you've been on, but what?
What?
She's probably thinking, I didn't do that with my kid. My poor kid was constipated.
We don't have to
Darn
get
it.
into that one yet.
My
but-
mom did, however, she is the one I have to thank for introducing me to chiropractic care. So at some point it was, hey, I think we need to do this. How fascinating, right? But what about for moms? Okay, so let's get into mothers as they are going through their pregnancy, and they're
Sure.
taking on so much.
So many changes.
How soon should they come in when they're told and they've got that elation of, oh my gosh, we're pregnant?
Correct.
How soon should they start coming, and then how often?
Well, a lot of times you don't know until 6, 8, 10, sometimes 12 weeks that you're pregnant. Usually until about the 20th week, we'll just do our regular weekly, bi-weekly, monthly adjustments.
Okay.
But around 20 to 24 weeks, we start to see the baby bump, coming out just a little bit more. When that happens, our center of gravity changes. Then we get that anterior pelvic tilt, the pelvis rotating forward, leaning back, kind of, just like that. Baby's out front. Mom needs to kind of sway back to get that center of gravity back over her hips. Then we're going to start having some low back pain. So we usually see low back pain starting in the 20th week or so, moving forward. At that point, I like to go about every 2 weeks until the 3rd trimester. Third trimester, we're going weekly.
Weekly.
Yes, because we're making so many changes between 32 and 40 that anything can happen during that time.
Think about all the pain, moms, that you went through and you didn't go to have the adjustments and all the work that they can do with chiropractic care. Again, mom's shaking her head over here like, I didn't go to a chiropractor. What was wrong with me? So you shouldn't. I think that's the problem in life. People think they should suffer through pain.
Yes. Pain's not normal.
No.
Pain is the way the body tells the brain, or the brain tells the body, something's wrong down there. We need to get this addressed.
Right.
And one of the most common things in pregnancy is low back pain.
Yes.
But that's not the only thing.
No. I have a
Oh,
lot of
gosh.
clients that I personal train, and I tell them, not only chiropractic care, but also there are massages, right,
Yes.
that you can go through that will make you feel better. So I have a lot of clients that have groin issues.
Yep.
They have hip flexor issues. They have IT band issues,
Oh, yeah.
right? All the
Oh, yeah.
nerves that baby might be pushing against.
That's the pelvis. So there's a protocol. It's called the Webster protocol. It's specifically for pregnancy, and it focuses on the pelvis, the round ligaments, which we can get into in just a little bit, hip flexors, IT bands, groin pain. So we don't only have low back pain, we also have the hormonal aspects that go
Sure.
into it. But with this picture here, so the area of pain, look, you're having groin pain. You might think it's a kidney stone or, oh, it's my hip flexors that are tight. As that uterus gets bigger and bigger, and it's shaped like a balloon, we have this round ligament that goes from the uterus down to the pubic bone. And the way that the balloon, the uterus, we want it to be nice and straight and face down. But as baby's moving, there's some torsion. It gets moved around a little bit, which puts more pressure on one of the round ligaments, so moms will get pain underneath the belly there.
Right.
It's kind of like a trapeze act, where one side, we're leaning this way. This side has to hold on a lot harder. That's again going to rotate the pelvis. So then we have to adjust the pelvis, but then we also do a nice, gentle round ligament stretch that helps even everything out and gets that uterus back into the middle.
And I love what you just described, gentle. Do you think that there are a lot of moms that don't come because they're scared? Well, what
Yes.
if I go to have massage and I'm not supposed to be laying a certain way? If I go to have a chiropractic, are they going to make sure they take care of me? Am I going to damage the baby? You probably hear all of this.
Oh, all the time. Baby is very safe. And the majority of this, again, up until 22 to 26 weeks, I would say, we're doing normal adjustments. There's no contraindication to doing that. After that, though, we get this hormone called relaxin that gets released into the body. It goes throughout the body, but it tries to stay kind of localized to the pelvis. Relaxin, the hormone, what it does, it relaxes the ligaments.
Hence, relaxin.
Yes, exactly. Sometimes they're easy.
It's like chillaxin.
Chillaxin. Sometimes they're easy, but like naming hormones is easy, but this one, it's so easy. I ask my patients, what do you think it does? I go, it relaxes you. Because we need, as baby's going to go down through the pelvic floor, everything needs to relax and open up.
Right.
But it doesn't just stay in the pelvis. It goes throughout the spine. So as more relaxin is being released, I don't need to do these high thrusting adjustments. Gentle pressure is all it takes. So a lot of times what it is just me holding, and I'll have the patient move just a little bit, and that's the adjustment.
Again, you're seeing the increase in the hormone relaxin during pregnancy causes what a lot of women say, the increased low back pain. But think about, as I just mentioned, sciatic pain, increased stress, heartburn, round ligament pain, all of these things. Are you all going, oh, yeah, I'm pregnant right now. I'm going through all of these.
Yeah.
And unfortunately, unless you hear and you get educated like this show today, many women just think, well, this is just what I have to deal with.
Yes. Oh, because again, getting advice from everyone. Oh, I dealt with the same thing. This is just what you got to do.
Suck it up.
Try vinegar. It's like, no, get adjusted. Come
Yes.
in. Talk to somebody about it. Because feeling this discomfort is not normal.
And just like we do when we're training you, first trimester, second trimester, third trimester, they all look different. I'm personal training you different. He's adjusting you different. No, we're not putting you on your back as you get into the third trimester. Taking care of you, as will they. And I think that's just the thing that we have to get out there, is to just stress there are things that can be done to not only make you feel better, but maybe even make that pregnancy and the delivery easier.
Oh, there was a study done. Women who got adjusted throughout their pregnancy had shorter labor times
Really?
and decreased pain throughout their labor. So
Interesting.
that's a selling point right there.
Yeah, and let's go through the benefits of prenatal chiropractic care.
Absolutely. So the controlling symptoms of nausea, there's sometimes we just can't do anything about the nausea. It's the morning sickness thing. It's just your body making changes. It's adapting to what's going on. So we get that morning sickness.
Sure.
But as we progress, as the baby's growing, we have to think about what's in our insides. All of that has to go somewhere, right? It's got to move out of the way. A lot of times what's happening is that stomach is being pushed up. So we're getting that acid that's coming up into the esophagus and causing heartburn.
Right.
So we have a couple maneuvers that we can do to help out and kind of shift things around a little bit. Reducing the time of labor and delivery. That's a big selling point for a lot of
of course it is.
a lot of my pregnant patients. Relieving back pain, neck pain, and joint pain. That's where the adjustment comes in, and preventing the potential of a C-section. So there's a it's a myth that we will flip babies. We're not flip. So if a baby comes in breech, I will use this Webster protocol. I'm not flipping the baby. Now there's a medical procedure where they get in there and they physically flip the baby. What we're doing with the Webster protocol is giving the body space so the baby can turn on its own.
It needs room in there.
It needs room in there. And if that balloon is shifted so much, baby doesn't want to turn. So as we get the uterus back to where it's supposed to be, give it room, the baby naturally flips down.
Interesting.
Head down, which is where we want it.
I'm fascinated by all of this. Right? Any of you that already had babies, maybe you're out of the ability to have a child, but still pass this along to your kids, your grandkids, friends' kids, etc. Show them this show. And we always ask you to like and share and follow our live streams. If you have to run off and you miss any of this, be sure to come back and then share this with someone again, I'm now going to share this with my two friends who just had babies within the last couple of weeks to make sure that now they take care of themselves, which is where I want to go. We're going to take a quick break. When we come back, I want to talk about after the baby is delivered. And as you are going through your beginning first couple of years, I'm just thinking about the way moms hold their babies. They usually cock the baby on one hip, and all I can always think is, oh my gosh, you are so out of alignment. That's my thought process. Let me see if I'm right on that. We'll find out when we return.
Hi, it's Monica Adams. Thank you so much for following along with The Real Monica Adams Show since we launched back in March. But I wanted to let you know there's so much more that I could do with you, your business, your corporation. Did you know that I'm a motivational speaker all around the world, as well as an MC and an auctioneer? So if you have an event, maybe a nonprofit organization, and you want to book me, just shoot me an email, info@TheRealMonicaAdams.com. Personal training, life coaching, and styling as well. info@TheRealMonicaAdams.com.
Welcome back, 7:28, and I think we'll probably have a lot of new viewers today that I met over the weekend, and I said, when you pop on, be sure to say hi and let me know that I met you, and I know you're going to fall in love with the show. To all of you, good morning. I will get a chance to say hi to you maybe towards the end of the show. Let me get to some of the comments that are coming in of people who actually have been doing the things, which is good, that Dr. Sean Neary is talking about. If you've never been, by the way, to Mid-America Spine and Rehab, let's go ahead and put that up on the screen so you know how to get in touch with them, how you can get your appointment scheduled, and if you are currently, again, in your first, second, third trimester, or you know someone that is, and they didn't think about possibly going into chiropractic care, maybe now they're like, oh gosh, good, I don't have to go through this pain. So again, it's Mid-America Spine and Rehab. One lady said, I had a friend that took her baby to the chiropractor because of constipation issues. I love the fact that you knew that. I wouldn't have known that, but it's these type of things that need to be out there for you to go, oh my gosh, I can do something about that. Also, Kathy just dropped in a comment, Julie said, my daughter did the chiropractor while she was pregnant. She took them into the chiropractor and still continues after the baby was born. Baby will be 2 years old next month.
Fantastic.
Way to go. My grandson saw a chiropractor just a few days after he was born. Makes all the difference in the world.
Love that.
But this is the chiropractor you need to take them to. Thank you for this topic, somebody just said. So it's Mid-America Spine and Rehab. The phone number, by the way, is 314-966 8989, and they're located in the Rosalitas Plaza. StayWellSTL.com. You just saw up on the screen. 1030 Old De Pere Road. So let's talk about moms taking care of themselves after the baby is born and
Yes.
in those beginning years when they have the child just constantly in their arms.
Oh, yeah. One of the big questions I always get is, how soon should I come in after I
Right.
give birth? I said, as soon as you feel comfortable. Because as we know, every delivery is different.
Yeah.
Some have a lot of complications. Some are, I pushed twice and here's the baby. Which like
We were in labor for 5 minutes.
I know, like, that makes me
15
so
hours
happy.
to 5 minutes.
Right.
Exactly.
But as moms start moving around a little bit more, you're carrying the baby basket, the carrier, taking it to the car and back.
Yeah.
Usually on one side. So we are tilting. And then, center of gravity, we're going to twist and contort our bodies to make sure we don't topple over.
Right.
Because as moms know, what's priority after birth? That baby.
Sure.
So we're going to protect the baby. We don't care about ourselves as much. But then you start to develop all these aches and pains and low back stuff. Knee issues is another one. Holding the baby is the other one you mentioned.
Well, I see a lot of shoulder issues.
Shoulder issues. Because
Neck issues, back issues, hip, knees, ankles, all of it. And you
Yeah.
wonder, where's it coming from? It's because you're so heavily one-sided.
Yes.
And that happens in a lot of life. But it's also, you just mentioned, carrying the baby. They also probably swing the diaper bag. They have their purse, everything over on that one side,
on
right
one
side or left side.
And also think about putting the baby to bed. You're bending over and twisting and putting that baby down in an adverse position. So you're hurting yourself, but you're worried about the baby.
Right.
Get the baby down first. So I have a couple of suggestions if moms want to come in about how to properly carry the bags, carry the carrier. There's like a twisting arm. You can look it up. I would have thought of it because you think you would just hold the handle. Oh, there's a way that you twist your arm around and hold the bottom that centers your body.
Really?
It's fascinating. I wish I would have brought a picture of that one.
Well, I'm glad
How
that
about
they're
it?
coming out with these type of things.
Yes.
Again, we always say that medicine always evolves, but so does all of these little apparatuses.
Well, we think of ergonomics with
Yeah,
work, but
right.
there's also, maternal ergonomics that we have to think about. Again, putting the baby down properly. How are you sitting while you're feeding?
Right.
How are you carrying the basket? All these things that we don't think about until you're going through them.
Right.
Yeah. I was going to say, when holding the baby, I make these suggestions, and I go, I know this is going to be hard, and you're not going to do it. But you hold the baby on the left side, usually because you're right-handed, so you want to be able to do things. So just switch the sides. Just switch sides for 3 to 5 minutes. You're going to go right back. I know you're going to. But unless you're not aware of that, you're not even going to think about switching sides.
So you want them to be ambidextrous.
Try to be ambidextrous, just a little bit.
We had my friend Dot on a couple weeks ago, and she talked about a particular author that mentioned that if we really want to tap into the creative side of our brain, to use our non-dominant hand for like a lot of things. So I've been trying to do it lately, and I was like, gosh, this feels so awkward. I was trying to eat. I'm like, nope, can't do it. Switching back.
Missing.
Exactly. But yes, just to try to get yourself back, because you mentioned the word trauma. There is that trauma during delivery. I mean, think about what you incredible women have gone through, and then the baby's here, your blessing is here, but continuing to take care of yourself. I actually asked several ladies yesterday at the event I spoke at, please finish this phrase for me. Who's the most important person in the equation of your life? And they're like, my kid? My husband? And I said, nope, wrong answer, wrong answer, wrong answer. One lady at the very end said, I know what I would want to say, but I think I probably should say me. I'm like, ding, ding,
There it
ding.
is.
Yeah, there it is.
Yes, you are the most important. Take care of yourself.
Yes.
If you're feeling pain, discomfort, get it taken care of. Go talk to somebody about it.
But you see that as soon as a mother has that child and she was already taking care of maybe her husband, taking care of the animals, it's just another level of, I've got something else to take care of.
Right.
And they always say, well, I lose myself. And I said, I know, you got to find yourself again.
You got to find yourself.
Right. You got to
Yeah.
take care of yourself.
But when you're dealing, it's hard though, because in the beginning, when the baby can't communicate, how do they communicate?
Right.
They cry.
Right.
So what are they crying about? They want to be fed. They want to be changed. They want to sleep. But what if they're in discomfort?
Yes.
Then what do we do? That's when the mom feels very helpless.
Sure.
And that's why like I say, I want to check them out within the first week. There's a couple of reflexes that babies have that we don't have as adults because we grow out of them. They're called primitive reflexes. And I will run through the primitive reflexes, make sure that the baby's neurological system is working like it's supposed to. So if there's, you just look shocked.
I just think it's fascinating. I would not have ever thought of this. And I don't think a lot of you, I mean, you tell me, I don't think a lot of you probably have ever thought of it either. Somebody just said amazing information.
Yeah,
This is my favorite show with you.
Mine too. This pregnancies, prenatal care, pediatrics is one of my passions. I love working with.
Do you have a baby, Larry?
I'll find
If
one.
you have not watched the show for the last couple of months, Larry is our little vertebrae model that he brings in. And he named him Larry after?
My grandpa.
Yeah, who was a chiropractor. But we need a baby Larry now.
I'll find a baby Larry for
you.
you.
Yeah, because it's a little spine.
There we
So taking care of the babies, taking care of mama. Now, as you're going along, and if obviously it just depends on each patient as to what you're finding, but if someone's doing good and you've been seeing for a bit, my mom actually asked the question the other day, and she said, how often, I think it's a good question, you'll probably all ask, how often should you be going to a chiropractor for maintenance?
For maintenance, again, everyone is different with maintenance. I had some patients who are every 2 weeks. Now, if they go 3 weeks, they go, that pain is back.
Okay.
So I go, your maintenance is every 2 weeks. Some people are 3. Ideally, it's once every 4 weeks.
Okay.
Once a month.
That's what my mom, she was like,
Yeah.
I said, well, right now we're going once a week, but we have just started with him.
Right.
And we're finding the issues that we had, me from my accident, Jim from football.
Years of...
continuing to do the yard that I asked him to let somebody else do. Again, walking around having issues. None of us should be walking around in pain. And when you have someone that can take care of you, why do you not go? That's the question, and that's where I'm going to leave it. So staywellstl.com. There you go. 314-966-8989. He's really good at what he does, by the way.
Thank you.
Because one of the things that I think people stay away from is they're like, oh, if I get adjusted, I'm scared. What's going to happen to me? Am I going to be injured? Am I going to have pain? No, is the answer. And after we've gone to him, it's, oh my gosh, I'm sleeping better. I don't have a headache. Again, if you're going to a particular chiropractor and you're having issues afterwards and you stopped, because a lot of people will be like, this is not making me feel better.
Right.
Well, maybe you're going to the wrong person. So trust him. If I trust him, you should trust him.
Thank you.
And I also want you to support those that support us. That's the biggest thing. So again, spread the word that we do our Medical Mondays, and we kick things off with Dr. Sean Neary. Thank you so much for the information.
Thank you so much. This is a great
Fascinating.
one. Yes.
Again, staywellstl.com. Set up your appointment and let me know how great you felt after you went to him. Okay, we're going to transition to Dr. Sara Franco. She's with InVita Health and Wellness, and we're going to talk about some treatments that we haven't had a chance to discuss yet. You know, we're going from spring shortly into summer. What have you been doing for your skin as we got out of winter? There are so many different treatments that they can do, taking care of your body inside and out. We'll have Dr. Sara Franco when we return.
We need women to lift women up.
Let's do that. Being on Monica's show, it was like one of the best interviews I've ever had.
Monica's very real, and she really cares about people.
She's changing lives.
Changing lives.
I think this is just really what people want to see.
Giving back so much to the community, and I really appreciate it.
Today, Monica was extraordinarily real, not only with me, but with her viewers and her listeners.
Made the interview process like talking to a friend.
How are you doing? See you. Haven't seen you in a few weeks.
Hey. You're close.
Monica. Whoa.
So go out in this world and be anything you want to be. But before you do that, first, be kind.
Let's go. I just said it again as he was walking out. That was my favorite show for sure with him. Such great information, and a lot of people that can't watch live, please pass this show along to him, because my mom and I are both shaking our heads like a 3-day-old, and then all of a sudden, boom, they cooperate and they feel better. So I hope you enjoyed that. Again, staywellstl.com, and thank you so much to Dr. Sean Neary. So we transition from Dr. Neary to Dr. Sara Franco from InVita Health and Wellness. First of all, good morning.
Good morning.
Did you have a good weekend?
I did.
Was it a busy one? Because she's always crazy busy.
It was a busy one. Yes, we had birthday parties and hockey, and it was it's nonstop all the time.
What do you do to relax yourself?
Go to work, probably.
Get away from. Yeah, she's got a lot of kids,
yes,
by the way.
Yeah, there's a lot of kids there. No, I mean, just spending time with the family and everything, it's relaxing. It's just relaxing chaos, I think.
Sure, sure. So she's going to work. And she's got wonderful people that she works with. If you haven't been there yet, InVita Health and Wellness, 314-394-0950. There it is, InVitaHealthAndWellness.com in the Kirkwood area. I know a lot of you have been to her, which I love, taking care of the body, as we mentioned, on the inside and out. But they're literally, I went through, looked on their website, looked through the pamphlets that she has in her office, and I was like, there's still so much we haven't had a chance to talk about. So let's talk about taking care of our skin, doing some treatments as we already transition from one season to the next. It was a transition of winter and the dryness that happens in the skin to spring. So what did you do? If you didn't do anything, all right, are you a little bit behind? Mm-hmm. Well, they can look at all of this. So the great thing is, everybody's skin's different.
Right.
So the very first thing they need to do is a consultation with you, right?
Correct, right. We need to take a look at what your considerations and concerns are, what you're using on a daily basis, making sure that you're using the appropriate moisturizer, the appropriate sunscreen, those kind of things.
Yeah, because everybody's skin's different. So you could have one person that's over here using this moisturizer, and this person's like, no, that makes my skin oily. And this person's like, well, I have dry skin, right? It just like absorbs it all and it's gone. Meaning you're dehydrated, unfortunately. But as far as different treatments and different things that you can do, we're going to start. How about we start? Is it ND-YAG?
ND-YAG, uh-huh.
ND-YAG. First of all, what is that?
So it is a non-ablative laser that we use for really a variety of conditions. Depending on the wavelength, we can use it for hair removal. We can use it for skin resurfacing. We use it for tattoo removal. So it has a variety of uses.
And how long has that been around?
For like 35, 40 years.
Wow.
And they keep perfecting it over time. So whenever it first was introduced, it was only, it was very much targeted to, so we all have different Fitzpatrick. So 1 to 6, 6 being, the very, very dark skinned African-American, 1 being probably me, very, very light skin. And then everything in between. So we have to be very, very careful. That's why it's very important that you go to someone who is trained in lasers and has gone through those kind of courses, because different lasers are going to target melanin, or if you're wanting to target the hair, you want to make sure you're not targeting melanin, because you can cause hypopigmentation, hyperpigmentation, actually make things worse. So over the years they've developed different technologies so that if you are African American, you can get laser hair removal and things like that, but it's going to depend on the individual laser.
So one of the things people hear, laser, and they go, ugh, that sounds scary. Let's take them through what it looks like if they're going to come in and have this done. A lot of things, laser, IPL, all these things that people are hearing, it's the unknown. I was one of them. I'm like, sure. I don't know if I want to do that. Is it going to hurt? And she's not going to sugarcoat things for you. If there's a little bit of pain, I love the fact, though, that she has these numbing creams and stuff that she'll take people through. Because I've heard a lot of people write in and say, Monica, I'm still waiting for you to do the IPL. I said, I know, so is she. I've got to find a time I'm not emceeing an event. Like this past weekend, I had 2. I'd like to have some downtime. Not that you need it, though, right?
Not with IPL, not really. Your skin is going to be, it's very important that you really, really moisturize your skin afterward. But what happens is, depending on the amount of sun damage, it's going to bring those spots to the surface. Sometimes those spots actually kind of like fleck off, and then other times your body will just break it down and absorb it. But in the meantime, you have a lot of freckles.
Right.
So, yeah.
And I don't want someone, what? First time you're meeting me at an event, boy, Monica's freckly.
Right.
So, but IPLs, lasers, things like this that people do. And again, I know there's probably a bunch of you that are like, oh yeah, I've been doing that and I just love. Look at her skin. Does she not glow? She's been again, she preaches it and then she does it, and that she takes care of herself. But from the aspect of any kind of pain, any kind of downtime, the lasers. All right, so we're talking about ND-YAG. This particular one, is there any downtime with this? Is there any pain with this?
No, there's going to be, actually during the procedure itself, there's not a lot of pain. It's afterward that you, that things can get a little bit spicy. I generally tell people it feels like you have a bad sunburn. So you just want to make sure that and you would treat it appropriately. So if you have sunburn, you put moisturizer on it. We encourage Aquaphor. It's a very clean product that locks that moisture in. And you don't have to worry about other perfumes and things like that would, that could possibly lead to additional inflammation, not infection necessarily, but inflammation, erythema, things like that.
Okay.
Whenever you were talking, I had kind of a fleeting thought. One of the considerations that you want or that you need to think of, we do use numbing creams, particularly for the things that are going to be, we've talked about microneedling and things like that. But those pain receptors and that the body's feedback is often important. A lot of, and I feel like this is, we've seen this a lot with weight loss medication, with other things, it's like, well, let's just go a little bit harder. It'll, we'll get better results. Sometimes the aggression that you do is going to, if you would have an erbium laser at 200 versus an erbium laser at 700, you're going to notice a significant difference. But we want that feedback from the skin, because if something is really hurting, then there's a good chance that we're too deep, or we're in like fat layers instead of just the epidermal layer. So we want you to have a little bit of feeling, but we don't want you to leave there, uncomfortable, or be lying there uncomfortable.
So the whole thing of I always liken it to personal training. As we're going through it, not necessarily if there's pain and soreness, does that mean, oh, that's what I'm looking for, and I've got to have that no pain, no gain attitude. So if people are coming into Sara and her staff at InVita, you have to communicate. Right. You don't know.
Right.
If you just endure the pain and just think, I have to go through this. I mean, it's just like what I was telling Dr. Neary. These women are pregnant, they're going through that, and they're thinking, well, I just got to deal with the pain.
Right.
We want everybody to be walking around life feeling the best that you possibly can. And so does she. She don't want you going through these aspects of the lasers, making yourself feel beautiful and saying, but that really bothered me.
Right.
Well, I didn't know that. You didn't say anything.
Right. Pain is the body's defense mechanism. Mm-hmm. So, the folks that are born without pain receptors, you really have to watch out. That's your body saying, ow, there's something underneath your foot, or those shoes are too tight, or, you have a thorn stuck in the bottom of your heel, just something, letting you know that there's something going on. It's the same thing with the skin on the face.
So ND-YAG is the first thing that, again, we were talking about. So if someone's hearing all these, and we'll go through the other ones, and you said erbium as well, we'll explain what all that is. Again, you have, and that's what I felt. You have so many incredible things that I think a lot of times I don't even know where to start.
Right. It's very overwhelming. And we could sit here and I could give you a lesson on lasers. But the important thing is to just come in and you just talk to us and let us know. I have this age spot. And my hands are starting to look like my grandma's hands did, or, the little vascularities that you can get on your nose and on your cheeks. I have rosacea. If you let us know what your considerations and your concerns are, then we can let you know what the best laser.
You'll navigate and guide.
And sometimes it's a combination treatment.
Okay.
Maybe it's IPL, maybe it's an erbium. If you say, oh, I have this uneven skin tone, but there's these fine lines and wrinkles, but I also have these underlying dark spots that come out, then maybe we can do an erbium laser instead of just IPL, and we can take care of all of those things.
An erbium is what?
Well, erbium is an ablative laser. So the huge umbrella difference is going to be between an ablative laser and a non-ablative laser. Ablative lasers are going to be things like CO2 lasers, erbium lasers. Those are going to be the ones that target basically that dead layer of skin, the epidermal layer, but it actually is going to remove that layer of skin. So there's going to be a little bit of downtime associated, or at least at a minimum, you're going to look a little different for a few days as those things come to the surface and that new collagen is being, stimulated to be produced and things like that. Then there's the non-ablative lasers, which is basically everything else. So the ND-YAG, the IPL, the BBL, those kind of lasers are all going to be the non-ablative kind.
And so again, if you're coming in and she's getting a chance to look at your skin, she will guide you, direct you. It's kind of like when we go in and just from a relaxation standpoint, you go in to have a facial. At that point, there are things that your esthetician will say, I don't know if you know that this is going on. Again, you've even found skin cancer on people I think you might want to get this checked, which is what I really love. She's been telling me stories about things that she has seen or she's feeling. I really want to say something to this person, right? And I love that about you, because you genuinely do care about each individual that you come in contact with. And she's just like, I just feel like something's wrong, and I'd like to tell that person to go get this checked. And again, all you can do is put it out there and hope that they listen to you. But it's the same thing. And you're seeing things, especially, I just think I love the fact that when an esthetician is taking care of your skin and they're looking like, did you see this thing? But no, you can't, because you're not looking back behind your ear. You're not looking in your scalp. Beauticians, stylists, they do the same thing. Hey, you got something up here. Oh, I didn't know that. Nobody's, it's kind of like the orangutan. They're not going through and picking at you, but you all are. It's like, hey, I see these things. And then they're taking care of your skin, obviously. If you are doing lasers, how often are you doing that?
Generally, really once a year is if you're doing it for maintenance. Now, if you're really trying to, really get that collagen stimulated to be produced, or we're working on like a scar revision or something like that, then those are going to be repeated treatments. And we have to make sure that the skin heals all the way. That's going to vary from laser to laser how long that takes. Even something like a tattoo removal, we're looking at, 4 to 6 to 8 weeks in between, depending on how aggressive we were, what color the ink is, those kind of things. Those all need to be taken into consideration.
I'm going to take a break. When we come back, I want to talk about the scar aspect and something that I was asking her about from a personal standpoint. I know someone who has a port wine stain or a birthmark, and I know there has been a lot of advancements over the years. And for this person, I think it's decades, right, that they've lived almost 6 decades now through their life. And what we never want is that you just kind of give up and think that there's nothing out there for you. So I'm going to talk about this. We're also going to talk about the scar revision when we return with Dr. Sara Franco.
You are truly an incredible human being, and just what you're doing is so inspiring. This was really a cathartic experience for me. So I appreciate you, love you. It's been an honor to not only just be here on set with you, but just to sit in your presence. You inspire everyone around you, from your motivational speaking to your podcast here, to just being the human that you are.
It's just such a joy to be able to see you at this point in your career. Really following your passion, fulfilling your dreams, and encouraging other people to do the same.
I feel that I've been missing out. I believe God places people like you in people's lives for a reason. You have definitely been a God wink for me.
Welcome back. It is 7:52, and it's the Real Monica Adams Show. Thank you so much for all of you that are watching live. And those of you, by the way, that watch on replay, be sure to do a little hashtag replay. It comes to my attention. And if you're asking me a question, or if you have a question for Sara, we'll be sure to tag her in that and pass it along so that she can get back with you as well. We're talking about a lot of things with regards to your skin, transitioning again from the springtime and into the summer. More and more of you are out, and that's the dangerous aspect of what are you doing to protect your skin. First of all, you're putting sunscreen on. That is so imperative. One of the things I always talk about, some of my favorite shows, Sara, and one of them that Sara did months ago was talking about the number on the SPF. If it says 15, if it says 30, if it says 50, that's the minutes that you should be reapplying. Never knew that, and I've had so many people from that show say, I didn't know that either.
Right.
Again, we all think about going on vacation and we lather up and go, okay, I'm done for the day.
Right.
Nope, especially when it's like 15 or 30, you're like, wait a minute, every 15 to 30 minutes, that's crazy. But again, you need to take care of your skin moving forward. I love the fact Michelle just said, I can vouch her skin is flawless. No makeup, right? I mean,
no
look,
makeup.
She just glows, and that's what you all want. You want to be able to look like that. Well, she's doing these type of things. We mentioned we were going to go into scars. Think about people that have scars, and they want to live their best life, but they continue to look in the mirror and they're seeing something that just is hard for them, whether it's on the face or we're looking at that particular picture on your shoulder, anywhere, and you wonder what can be done with it. That's fascinating. I mean, look at that scar revision. That's mind-blowing, actually. So I want to talk about scars, and then we'll also talk about, again, port wine stains or birthmarks. Sure. So in that before picture and after picture, what kind of a time frame would that be?
That's probably a year later and several treatments. I would say probably 3 to 6 treatments minimum. Mm-hmm.
So what are you doing for that?
So generally, microneedling is going to be used to really break up some of that scar tissue and stimulate that collagen reproduction. And then we use lasers on the outside to target just some of the skin resurfacing and just kind of overall clear up that skin texture.
And for people who have not seen or heard of microneedling before, what's taking place in that?
So I equate it to, I try to simplify things. Basically, like you're aerating your skin. So this is your skin. You have the needles that go down and deliver radio frequency, so deliver some energy. And not all skin microneedling has that energy. If you use like a skin pin, any of the ones that like you scratch up and down and in circles, that's just going to be stimulating some collagen on that very, very stratus corporeum, the outer layer of the epidermis. But the microneedling is going to go down, stimulate that collagen production, and come up. It's going to leave those little, basically needle holes, and then the collagen's going to fill in underneath that and just kind of tighten everything.
It's again fascinating. I just love the advancements that have taken place, and that's kind of what I said going into the break. So for any of you, and this is a person who's very close to me, was born with a birthmark, and we're going to go back 6 decades ago. So what was being done at that point? They actually took skin from the collarbone and went to patch, is really all you could say, and it created this patch. It's not so much the birthmark that bothers this person as much as this skin graft, I guess, right? And he looks at that and think, what can be done with that? She wants to see a picture because there's a lot of people that said, oh, there's nothing can be done. It's into the lip line, nothing can be done. But I think the thing that has made this person get really upset and frustrated, and the person involved with them just tear up, because you know that you just want to do whatever you can to make that person feel better. They're all saying, I've seen burn victims. I've seen complete changes. I mean, we just saw that kind of. So it was always, you've got to be kidding me. There's got to be things that can be done. I remember it's probably been 20, 30 years ago when he started to say, oh my gosh, I heard about some things that they can do that was starting to make it lighter looking, right? And that's some of the stuff. So how many people do you have come to you that have birthmarks?
I mean, we have a great deal of people. You know, it seems like everybody's born. I've heard before everyone has a birthmark somewhere, you know, and so far it's panned out as true. You know, I look my babies over all the time and I'm like, oh yeah, you have one back there. But no, we have a good deal of patients that come to us with hemangiomas, with birthmarks, with just kind of a variety of moles, warts, a lot of things that they just, you know, that they've lived with their entire life. And, you know, I was talking to a friend the other day, and I had an exchange student 5 or 6 years ago that had a very large mole on her upper lip, and it really bothered her. I knew it really bothered her. When she would talk, she would kind of, you know, kind of do this and cover it up. And I had not a plastic surgeon, an ENT that I worked with when I was doing anesthesia that did a great job. He would do a lot of skin cancer removals, and his, you know, his suture technique was just amazing. So I asked him, you know, what would you charge me to take that off for her? So we worked out something, and for Christmas, with her mom's permission, of course, we had that mole removed, and just her self-esteem after that was just, I mean, it was so heartwarming that she was so happy and just smiling all the time and talking and so much more outgoing. And I know that is the case for a lot of people. So a lot of we do a lot of mole removals, a lot of hemangiomas, a lot of like the little vessels on the skin. You know, I know rosacea is a big concern for people, but then you get into the things that are there, I mean, all of the time, you know, regardless of if you're in the sun or not in the sun, or if you're stressed or not stressed, or and you know, things like port wine stains, and we are definitely able to not always remove them completely, but certainly lighten them.
So to do the lightening, what do you do?
It would be a laser for that too, and we're talking probably 8 to 10 treatments for a deep port wine stain. But all the different lasers are going to target different things. So some target pigment, some target melanin, some target hemoglobin. So any of the lasers that take care of like the veins and the vascularities in the face, rosacea. Some target water, like erbium, CO2, pixel, things like that. So it's all going to kind of go back to what condition you're trying to correct. For the case of a port wine stain, you're going to be looking at hemoglobin and melanin. So you would be probably using a variety, at least 2 different lasers.
And I do remember when he must have done something on those lines. But again, I also look at it, that's probably a good 20 years ago. So how far have we come? I mean, it's always fascinating how we evolve in medicine. Just like you had mentioned earlier, though, even when someone's just doing IPL just to make their skin look better and to bring that to the surface, when he did this about 20 years ago, it was the same kind of a thing. He's like, well, when you come to pick me up, it's going to be much darker, and it's going to be darker for several days. That's going to be the case, right?
It would be the case, yes.
And then starting to lighten.
Exactly.
And then do it again.
Right.
again, several treatments, so it's not just going to be like this. So isn't that fascinating? And then from the scar standpoint, there are so many people that think they just have to live with the scar, and depending on how they injure themselves, and as you just mentioned, how the suturing took place, and what did the person that did that did do a horrible job, and then they look at that, especially when it's on the face, but I mean anywhere on the body, as you mentioned, it's everyone walking around that doesn't feel their best,
right?
And they're covering themselves up. They don't want anybody to see it. They're putting layers on because again, you're all beautiful, but you feel like you're not. And so she's coming in, kind of the hero, being able to say, well, hey, you don't have to live like this. Like there are things that we can do. We're talking about a lot of non-invasive things. Are there any invasive treatments that you do there?
Well, I mean, if really anytime I wouldn't call a laser is going to be non-invasive. If you're doing microneedling, then anytime you're puncturing the skin, I tell people, I'm like, if I have to wipe you off with alcohol several times before we get started, then there's always that risk of infection. So the microneedling definitely for a lot of scars. There's also like hypertrophic scars where they get like that very red, raised, hard appearance. There's keloids that a lot of African Americans, Hispanic, some regions in Europe, their skin tends to keloid worse. We can sometimes we can inject different steroids, triamcinolone, things like that, into those to lighten them and soften them, and then use a laser to kind of work on the overall appearance. So oftentimes it's going to be a combination of different techniques and modalities that we use to get rid of, to either, I shouldn't say get rid of, but to at least minimize the appearance of these issues.
And again, I think it's fascinating for you to look at those things that you may have and in your mind think there's nothing we can done about it. But now you're hearing that. If you are, if there's family or friends that you know that by chance are dealing with something like this, I want you to pass along this show to them, have them watch later on a replay, because again, I understand that a lot of you have to rush off to work and you can't watch the entire show live, but say, oh my gosh, I heard this, because trust me, if I was one watching this show and I know this particular person that lived their whole life with a birthmark and there's something that can be done about it to make them have their self-esteem back, I mean, that just makes you go, I need to let you know that this exists, if you didn't know already. Before we wrap up, Michelle actually had a good question the other day, and we can go more in depth on this maybe next week. Are there things that you do for people who suffer with allergies?
There are, yep. Actually, you can have Botox injected into...
For allergies?
Yes, you can do Botox injections into the turbinates, and it's going to keep them. So what happens a lot of times when we get super, super congested, root cause, we have to get to what's causing the allergy. Everybody has allergies right now. The pollen count is like a billion. Like I got in the car and I'm like, our car looks green.
Everywhere.
Like green and yellow everywhere. And one of my triplets just like I got a note from school that was like, we're going to have to keep him either inside for recess or you're going to have to give him medication. I'm like, I give him Zyrtec and Singulair and Flonase every single morning. So, and I'm the same exact way. So you have to get to root cause. I mean, you're going to have to do histamine blockers and things like that. That's going to be what a big cell is going to be. But honestly, nutrition, hydration, and then, what was I talking about with the allergies?
Botox.
Botox in the turbinates. So a lot of times what happens with the turbinates, so those are the kind of like, if you look up in your nose, those are like the pink pillow looking things. Yeah. They get hypertrophic, and that's what makes you feel all congested. If you inject those with Botox, then they can't get hypertrophic anymore, because that's like not a muscle, but kind of a little muscle that's in there. Yeah. So it doesn't cause it to constrict, but it just keeps it from getting larger. So then you are able to better administer and absorb and things like that, things like Flonase and ocean nasal spray and things, just to kind of
I have learned so much from today's show. Have you not? I mean, again, people hear of Botox and they may have an aversion to it. They've heard, I'm not doing that. Or people start to think, well, Botox, it's only from a vanity standpoint. No. Not only allergies, which I never knew about, but I have a future show I want to do with you and Sean together talking about what you do for migraines. Botox for migraines.
You can do Botox for migraines.
What? Yeah. Did you know this?
For TMJ, you can do a variety.
How is it helping? Well, look, somebody just said, what?
Yeah. So so there is, everything in the face is muscular, right? So if you like for TMJ, for instance, if you grind your teeth, then that muscle, this masseter muscle that's back here, if you like clench your teeth together and you feel this get bigger, then you probably at night grind your teeth a lot.
We're all doing this, right?
Everybody's. So we can inject Botox into this area and then a little up near the temples because that muscle kind of comes down and around. And when you do that, it keeps you're still able to chew. So you're not gonna have to like blend your food up because you can't chew it anymore. But you're not able to bite like that sustained hard bite together. What that does is, when you're not able to do that at night, then you wake up and you don't have all that pain. You don't have the pain in the jaw, but it also causes some atrophy of that muscle, because this is a muscle in your face, just like the muscles in your arms that you work out. So if you're biting together, that's going to get bigger and bigger and bigger. So then you get like some facial slimming, and then you wake up and you haven't ground your teeth to the point of having a headache and everything else.
We haven't really gone in depth about Botox, and I do because I know we're at a point where a lot of you have to rush off. Yes, a lot of people learn so much on Medical Mondays. I know. That's why I started. I love it. I love the Medical Monday. Somebody else said, such a learning experience. It really is. Oh, somebody just said port wine survivor. # port wine survivor. Yes. So I wanted to go in depth. So we want to do this on a future show. Let's talk about Botox and the many things that can be done. Not what you're thinking it's for, because a lot of people are like, oh, Botox, I'm scared. Is it going to make my face freeze?
Sure.
All right, all those things. Let's not go there yet. I want to do this on a few. You want to do this next week?
Sure, we can do it next
All right,
week.
let's talk about Botox, but let's talk about all the benefits, and we'll go more in depth. We may even repeat what we just said, because I know a lot of you may have missed it in the last part of it. Let's do the 100 Days to Freedom. Pick a color for me, Sarah.
Oh, let's see. Let's do the dark blue on bottom.
That's
your journal.
Oh, yeah, that's my journal.
Okay.
The other blue?
Yeah, let's do the other blue.
Which is anger.
Oh.
Uh-oh. 100 Days to Freedom from Anger. We'll do that when we return.
InVita Health and Wellness, where you can feel your best both inside and out. InVita isn't your typical med spa. They're a multi-specialty medical spa and wellness center serving St. Louis and its surrounding areas. They have ketamine for mental health and pain, IV therapy, medical weight loss, and aesthetics treatments. As board-certified anesthesia providers, InVita can ensure that their advanced treatments are provided safely with minimal to no pain. So let InVita take care of you. Call 314-394-0950 to book an appointment, or online, InVitaHealthAndWellness.com.
It is 8:07 and we're wrapping up our Medical Monday. Really, truly, I think I just have a huge smile on my face because I've learned so much, and I hope you have as well. Do us a favor and share this show with everyone that you know on your pages, and do little hashtags, because again, I'm going to go back and edit this and edit up the hashtags, because there's so much that have been said in the show that I didn't originally know that we'd be talking about. So grabbing different people, when you do those hashtags, you again are able to spread it through all your family and friends that are following you. So right now on Facebook and on YouTube, Help Me Lord, that is today's day 21 of 100 Days to Freedom from Anger. These are daily devotionals from Stephen Arterburn. Keep your servant from deliberate sins. Don't let them control me. Then I will be free of guilt and innocent of great sin. May the words of my mouth and the meditation of my heart be pleasing to you, O Lord, my rock and my redeemer. That's Psalm 19, verses 13 through 14. So think about this. Has anger become a habit in your life? That might seem like a strange question. Habits aren't feelings, or are they? Perhaps after a fit of anger, you have offered the excuse, I can't help it, it's just the way I am. How many of you have said that? We all have, let's be honest. Or maybe you say to yourself, that's the last time I will lose my temper. You make a promise, you swear, yet there's no change. Days become years, and then a lifetime of being angry. Ready to break the habit? Well, the first step is to recognize that anger is a good thing. That's not a good thing. That happens too. Anger is a habit, and it has become your way of dealing with life. Maybe I'm hungry. I'm not going to get hangry, Sarah, I promise. It can feel shameful to admit this habit, but you are loved by a forgiving God who wants to help you be the person you were created to be. Rather than making a public announcement that you're going to break this habit, keep your decision between you, God, and maybe a couple of trustworthy people who will be supportive in your recovery. I always say that. I said yesterday to all those women, you are the sum of the 5 people that you hang around. Well, if you're trusting in the 5 people that are around you, start leaning on them. You'll also be able to find if you can trust them. You'll find out things that they might be sharing to others that you were like, nope, I guess you're not one of the trustworthy ones. I hope you have those, though, around you that you can lean on. Recovery from a habit or an addiction requires a process of changing the way you think. Actually, everything will change. You'll begin to experience life in a completely different way. The habit of anger will be broken, and it's replaced with peace. Recovery doesn't mean you will never be angry again. Anger has its place in our range of emotions. Breaking the habit means that you're no longer driven by the need to react in anger. The first step is to admit anger is a problem. So why not start today, right? Let's make that shift today. Alan de Boyton said, bitterness is anger that forgot where it came from. I like that one. Mitch Albom, we had Mitch on the show. I love him. Holding anger is a poison. It eats you from inside. We think that by hating someone, we hurt them. But hatred is a curved blade, and the harm we do to others, we also do to ourselves. That's a really powerful one, Mitch. That's a good boomerang. Joyce Meyer, if you want the great and mighty things God has for you, you must get to the root of your anger and deal with it. Today's prayer, Lord, I admit that anger has become a habit in my life that needs to be broken. Help me as I begin to make changes that will allow others to see you in me. Heal my brokenness and my pain. Help me to receive your grace and mercy that you so freely offer. Thank you for hearing my prayer, Lord. Amen. Good ones. And I love the fact that we had Mitch in there. I need to get Mitch back on the show. What an incredible author he is. Sara, thank you, as always, for all the incredible things she does. But we also have to thank you for watching, receiving the message, getting the education, and then sharing it out to the world. I love that we have so many new people that will be watching the show that we found yesterday. Everywhere I go, I'm just spreading the word of optimism and saying, do you know that this is where we are and how you can wake up every day? Monday through Friday, 7 a.m., spreading the word of positivity. All right, we say it all the time. I'm going to let her say the final words today. Remember, you can go out and be anything you want to be in the world, but before you are anything,
be kind.